my colleague, Dr. Una Kennedy, is going to speak next on a related area. So Una is a practicing GP in Dublin and GP advisor to the National Cancer Control Programme. And she's going to focus on acting on potential early signs or symptoms of cancer, know the signs and find cancer early. So I'll hand over to you now, Una. Thanks.
Okay, thanks, Trina. Can everyone see my screen?
Yeah, you're just not in presenter mode yet now, but we can see the slides, yeah.
Okay, so where do I find presenter
Probably
mode?
slideshow in the middle, let's say this.
Okay, I can't see it.
Una, if you'd like to scroll, bring your cursor down to the bottom right-hand corner of the screen, you should see, you've zoomed in. Oh, perfect.
Okay, got it?
Yeah, you're up there. Thanks.
Thanks, Trina. Thanks, Trina, and thanks everyone for joining today to talk about this really important topic. So how to detect cancer early if you end up having cancer. There's over 200 cancers in humans, and I always think that's an awful lot of humans and an awful lot of cancers, and it can feel quite overwhelming. This chart shows data from the National Cancer Registry, and if I can draw your attention to the grey bars at the far right of the screen, if you look at the bottom of those grey bars, you can see the top 5 cancers in Ireland. They're prostate, breast, colorectal, that's bowel, lung, and melanoma of the skin. Those 5 cancers, 4 in men and 4 in women, will account for almost 60% of all the invasive cancers you will see in Ireland. So those are the ones I'm going to focus on today. And what does it look like for men and women? Well, this is what it looks like. For men, prostate cancer accounts for almost 1 in 3 of all invasive cancers that we will see in this country, followed up by colorectal, followed up by lung, and followed up by melanoma. When you look at women, there is a remarkably similar picture for women. If you just substitute the word prostate for breast, it's almost identical. Breast cancer accounts for 1 in 3 invasive cancers in women, followed up by lung, followed by colorectal, and followed by melanoma. So 4 in men and 4 in women, and they will account for almost 60%, well over half of all the invasive cancers that you'll see. And why are we so bothered about early detection? Well, this is why. We know that cancer is broadly, very broadly divided into 4 stages, stage 1 being early stage and stage 4 being late stages. And this chart shows your chances of survival in Ireland if you're picked up with early stage versus late stage for those 5 common cancers. The green blocks show your survival for 5 years if you're picked up at stage 1, and the red blocks show your survival for 5 years if you're picked up at stage 4. And what you can see very clearly is that for most of the really common cancers, if you're picked up at an early stage, your chances of survival are really quite good. They're in the high 90s, but they drop quite dramatically if you're picked up at stage 4. And I'd like to draw your attention particularly to bowel cancer, where at stage 1, your survival is 95%. At stage 4, your survival is just 11%. Bear those numbers in mind when we talk about bowel screen in a few minutes' time. So just to go through, we'll fly through some of the common signs and symptoms for these cancers, kicking off with prostate cancer. So signs and symptoms you might expect with prostate cancer would be passing urine more often, getting up at night to pass urine, difficulty passing urine, and urgency. That's when you have to get to the bathroom in a terrible hurry. Now, these symptoms can also occur with benign overgrowth of the prostate, that benign issue of the prostate getting larger in men as they get more old. That's a perfectly normal thing. It's entirely benign, but they can also happen in prostate cancer. So if you have these symptoms, you shouldn't panic. More than likely, they won't mean that you've cancer, but they probably should get checked out. Passing blood, urine, or the semen would not be typical of benign overgrowth of the prostate. For breast cancer, well, we all know that we have a breast screening program in Ireland, and we can't really talk about breast cancer without mentioning it at least. It's open to all women aged between 50 and 69, and they get a mammogram every 2 years. Breast Check, the breast screening program, is picking up about 1/3 of our breast cancers in Ireland at the moment. So it's a very effective screening program, and if you're not enlisted in it, probably you should think about getting signed up to it. However, even if you are attending Breast Check regularly and having your mammograms, and even if you're falling outside the age range for screening, you can still develop cancer, notwithstanding all of that. And these are some of the signs and symptoms that you should look out for. The big one we all know about is the lump, be it a lump in the breast itself or a lump in the armpit. The other sign you'd look for would be lumpiness, and that would be if one breast is lumpy compared to the other, or if there's an area within one breast that's more lumpy compared to another area. You may not, of course, have a lump at all. You may have nipple discharge from one or both nipples. You may have nipple retraction, and that's where the nipple normally protrudes, but where it's dragged back into the breast and sunken in the breast. There can be skin changes such as ulcers or eczema that won't go away, or dimpling of the skin. And this is where the skin develops a thickened, pockmarked appearance, a bit like the skin of an orange peel. And finally, breast abscess. Next one up is bowel cancer. And again, like breast cancer, we can't talk about bowel cancer without mentioning bowel screening. And this is our bowel screening program. It's available to all men and women. It's really the only cancer screening available to men in Ireland. All men and women between 60 and 69. It's every 2 years and it's a fit test. So you phone up or you go online, you register, and they send you out this kit. And it has a little blue turquoisey kind of dipper in it. That comes out to your home. You dip it in the bowel motion, patch it all up, and send it back to Bowel Screen via free post. Bowel Screen is really good at picking up early stage cancer. So you remember what I was saying about your survival for 5 years being 95% if you picked up at stage 1 bowel cancer, 11% if you picked up at stage 4. Well, 60% of the cancers found on Bowel Screen are stage 1 or 2. It's really good at picking up bowel cancer early. So it would be strongly advised for all people within this age group to consider signing up for Bowel Screen. However, if you do develop bowel cancer, these are the signs and symptoms that you might expect. Rectal bleeding, that's prolonged, typically going on for more than 6 weeks. A change in bowel habit, particularly diarrhea, going on for more than 6 weeks. A low blood count with a low iron called ferritin. Unexplained weight loss that you haven't been trying to achieve. A mass in the tummy or in the rectum if somebody examines you. And finally, family history, which of course is not a sign or a symptom, but if you have a strong family history of bowel cancer in a parent, a child, or a sibling, especially at a young age, that might put you at increased risk. Lung cancer mightn't be well known, but lung cancer is Ireland's biggest cancer killer. It's not our biggest cancer, but it's our biggest cancer killer. And the one sign that everybody thinks about is coughing up blood, haemoptysis. And right enough, if you have haemoptysis, it should be checked out. But the problem with haemoptysis, coughing up blood, is that it's not a common first sign of lung cancer. Only 20% of people with lung cancer will ever have haemoptysis at any stage of their disease process. And it's a first symptom in just 5% of lung cancers. So certainly get it checked out if you have it, but you can't be waiting for blood to come up. You can't be sitting at home thinking, I'm grand as long as I don't cough up blood. It doesn't work like that for lung cancer. Unfortunately, this is a busy slide. Unfortunately, the signs and symptoms of lung cancer can be very vague. It's not like breast where there's a big signal symptom like a lump, or even bowel where there's a big signal symptom like passing blood. The signs and symptoms of lung cancer can be vague to start off with. This slide is available on the NCCP website. And what we've done is combined the typical symptoms of lung cancer with the person who's most at risk. So who's at risk? Men and women, older age, usually over 50, smokers, ex-smokers, and passive smokers. Lung cancer is strongly associated with socioeconomic deprivation, and as Mary mentioned earlier, it's associated with high levels of radon. So that's the person who's at risk. The signs you might get would be a cough or a changing cough in somebody who always is coughing, like a smoker, appetite loss or weight loss that you haven't been trying to achieve and you can't explain, a new cough in somebody who's never coughed before, particularly if it goes on for more than 6 weeks, chest or shoulder pain, becoming easily breathless compared to what you would have been. So, for example, if you say, I could always walk down to the shop to get the newspaper, I can't anymore, I get out of breath, consider that. Or if you're really, really tired compared to what you used to be. And finally, the last common cancer, melanoma skin cancer. As Maria said, most of the skin cancers in Ireland are associated with sun exposure, so we need to keep out of the sun in this country. We should be checking our skin regularly, and if you do check your skin, think A, B, C, D, E. A refers to asymmetry in a mole. If you have a mole that is asymmetrical, most of our moles are nice and round. B stands for the border, which could be irregular. C stands for at least 2 different colours in the mole. They normally have a uniform colour, but there's 2 different colours. And D refers to the diameter greater than 5 millimetre. And finally, E stands for an evolving lesion. So if you have a mole that's getting bigger or uglier or darker or starting to bleed, or there are little moles popping up in the skin all around it, That's a mole that's evolving and changing. That should get looked at. A good thing to think about is the ugly duckling lesion. You can see it at the bottom of the text there, the ugly duckling mole. So if there's one mole that just stands out and looks different to all the others, consider getting that checked. And really, we should all be in the habit of checking our skin all the time. At least with the skin, it's not like lung cancer where you may not see a tumor, or bowel where you may not see a tumor. You can see your skin. And there's a strong argument that we should all get into the habit of checking our skin every day. You hop out of the shower, take a good look and check for anything unusual. And last of all, it's worth remembering that not everybody fits the typical pattern for symptoms. So there are some vague symptoms that may mean nothing, but that probably should get checked out if you have them. The lump or a bump or a changing lump or bump anywhere. Abnormal bleeding, bleeding anywhere, the bowel, the urine, coughing up blood, vomiting up blood, or bruising. Bruising is bleeding, and any bleeding between periods or after you've gone through the menopause for women. A mole that's new or changing. Weight loss that you can't explain. If you're losing weight without trying to, that's a hard sign. You're very, very tired compared to usual. You have a cough going on for more than 3 weeks and you've never had a cough before. If you have a change in your bowel habit that is going on and not settling down after about 6 weeks. And finally, indigestion that doesn't go away. So what do you do about all of this? Well, the first thing is to know the signs. And I think Irish people pretty much do know the signs and symptoms of lung cancer. But be vigilant for them in yourself. There's no reason why you can't be checking the breasts, and there's no reason why you can't be checking your skin, for example. Remember that early detection will help. I mean, if you get a fright and if you find a lump or a bump or you pass blood, it is perfectly normal to get alarmed and to want to bury your head in the sand. But really, there's hard data to show that if cancer is picked up early, your outcomes are so much better. Contact your GP as soon as possible. Get on the phone and make contact. And remember, we now have rapid access clinics in Ireland. There are 8 of them dotted around the country for lung, breast, prostate, and there are pigmented lesion clinics in various locations around the country for suspected melanoma, where you can be seen quickly if there's a suspicion of cancer. And that's me. All that information is available on our website at hse.ie/cancer. And thank you all for listening.